health diplomacy and sharing expertise. I will also promote research development in traditional medicine, aligning with the WHO Traditional Medicine Strategy 2025-2034. Excellencies, as I conclude, I stand before you not merely as a candidate, but as a dedicated partner, unwavering in my commitment to our shared vision of a healthier, stronger region.
Jacob.
With a proven track record in health leadership and clear vision of continuity, I pledge to serve with integrity and determination. I seek your trust and your vote. Thank you very much. Go to the court.
Thank you, Professor Jacob. We'll now continue with questions and answers. I shall ask the Secretariat to take the board, show everyone that it is empty, and pass it around to collect the name tags. Professor Jacob, you may either remain at the podium or take us name tag. Equatorial Guinea. Equatorial Guinea, you have the floor.
Thank you very much. I'd like to ask the candidate about what would it be the strategy for small countries and islands in terms of getting more attention, in terms of their support of improving the healthcare system as a whole. The question is coming in relation to sometimes there are confluence of interest in terms of where to put the priority of the little resources that we are managing on the continent, and the approach tends to be prioritizing big countries. But sometimes
Equatorial Guinea,
small
you have
countries
one question.
can be the opportunity to say, okay, so what would you do about securing the support from WHO under your leadership? Thank you.
Thank you, Honorable Minister, for a very important question of small islands. And if I can give examples, maybe we are talking about Seychelles, Mauritius, Comoros. You face unique challenges such as climate change, limited healthcare infrastructures, and vulnerability to health emergencies. So, if elected, I will ensure these nations receive a targeted support to address these specific needs. First, I will advocate for tailored strategies like strengthening your health system, improving access to essential medicines. I know small islands depend a lot on imported foods. Unfortunately, these are seasoned foods which come with a lot of salts, increasing NCDs. Will focus on training and retention of your workers. But the other thing is an innovative method like telemedicine or artificial intelligence, because you can cater with telemedicine, do consultations with neighboring nations while building your workforce and capacity on health or human resources for health. So you have specific needs. We'll make sure that you get preparedness with all the health emergencies, because you are prone to preparedness like any other country. So prepare on surveillance, which has to start now before the emergencies start. We'll assist recognizing the vulnerability to climate change. So I will support development of climate-resistant healthcare infrastructures build on early warning signs. And lastly, I'll try to prioritize integrating small nations into larger regional health networks, ensuring you have representations during decision-making bodies, because this is where your voice has to be heard and have the data. Thank you.
Thank you, Professor Yacob. We now ask South Africa to ask the question.
Thank you very much, Professor. Do countries need to be rich to implement universal health coverage for their citizens? Why are countries on our continent which have got universal health coverage so few? Thank you very much.
South Africa, just one question. Can you limit your question to one?
It's one question divided into two, Honorable Chair.
I'm sorry, just one. Which one of the questions you want him to answer? Countries rich or
No.
what? Which question?
Okay, I was asking whether countries need to be rich in order to implement universal health coverage, and why in our continent they are so few.
No. Please answer, Professor Yacob.
So which one, the rich one or the... No, Honorable Minister, thank you for the very good question. And does the country have to be rich to have universal health coverage? No, let me maybe start by, I firmly believe that primary health care and universal health coverage, one, they are inseparable, and they are foundation of achieving an equitable, sustainable health system. So my vision of is just all about planning. I'll give you an example. In Tanzania, we've made a significant stride in this area by having we call it senior advice on health policy, where we expanded our primary health care infrastructure to underdeserved areas. Because one of the challenges when I was moving around, one thing, you have to build on your community health workers, because these are the people who have the trust of the villagers or the underdeserved. They are the people who are communicating with your general population every day. So equipping the frontline workers, like community health workers, and there's other thing which unfortunately is not very prominent in Africa, they call nurse practitioners, because you don't have enough doctors. So if they get training on basic things like immunization, maternal and child health, health education. So these efforts will improve access, but the country has to be rich. My personal experience, I'll say this. One of the things about health insurance, I don't think we've given enough education. You know, I've moved around in most of the member states. You find our members of national health insurance, they are those who are sick. So you have 80% of your members, they are sick people, and only 20% are the healthy ones, and these are the mandatory ones. So I think it's all about health education to our people. They should start getting insurance before they get sick, because it becomes even more expensive for the national insurance, and that's why most of them, they don't succeed. So at the regional level, my priority will be to try to scale up and use some context-sensitive models. And I'll work with you, honorable ministers, so we can discuss. We have got 47 member states with different economies, different population. Talking of Seychelles, 100,000 people. Talking of Nigeria, 220 million people. So each country has to deal specifically
Professor
what
Yacob.
are the challenges and how we can solve them.
Thank you very much. Cameroon, you have the floor. Cameroon, lucky today.
Thank you. Merci.
Thank you, Madam Chair. I have a simple question for the candidate. What can he do to enhance the impact of the regional office in shared initiatives among several countries? We have been working to tackle epidemics and on vaccinations with certain countries, but we can't quite clearly see the impact of the regional office in this. So what is he going to do to enhance its visibility and impact?
Question que j'ai posée, madame.
I just asked the question, madam.
Qu'est-ce que le candidat va faire?
What will he do to enhance the impact of the regional office on shared initiatives among several countries, especially tackling epidemics and on vaccinations?
Can you, Cameroon, repeat the question? Just only the question, not the background.
Thank you, Madam Chair. I wanted to just ask the candidate, what will he do to enhance the impact of the regional office in initiatives that involve several countries, especially when it comes to tackling epidemics and vaccination, because in our sub-region, especially Chad, DRC, and Niger, we have joint campaigns, but we're not quite seeing the impact of the regional office in these initiatives. What is he going to do to enhance that? Thank you.
Thank you, Honorable Minister, for a very pertinent question about, I think if I got it to you right, is your representations of the countries which you have mentioned. I think my response will be, if elected as a regional director, one of the first things will be to sit down with the members of the Secretariat, the members who I'm going to meet them at Brazzaville, and see, because we are all aware of the restructuring, reorganization, which is happening at the HQ, and I'm sure we have to get prepared with the 6 regions of the WHO. So I will sit down with the members, see how the organogram will look like, discuss openly with everyone, listen to member states. And I think from there, I will be in a better position to see what you are saying, which is very important, the equal distribution of the positions. We are 47 member states. I think regardless of the size, the economy of your country, this is our organ. All of us has to be there. I know we don't have 47 positions at AGO, but we'll share the positions according to what I'm going to see on the ground. Maybe it's a little bit too premature for now, but what I promise, there will be equal chance for everyone, depending on your qualifications and your integrity, you'll get a position. Thank you, Madam Chair.
The Gambia.
Thank you very much. We thank Professor for that presentation. Professor, one of the biggest challenges we have as countries is the issue of getting high quality medicines and medical equipment for our nations, and that contributes immensely to the poor health care services delivered. Now, the financial challenges are there. No matter how much resources we mobilize domestically, if these prices keep on skyrocketing, we'll never get what we want. What are your strategies in dealing with pharmaceuticals? equipment manufacturers to ensure that low-income countries in your region, if you are elected, are able to procure these items at a reasonable price for our people? What strategies will you use? Thank you.
Thank you, Honorable Minister from Gambia, for a very important question. And if I step back, COVID-19 exposed us how vulnerable and the gaps which we saw. But to me also it gave us a footprint, a blueprint, to see the deficiencies we have in diagnostic, therapeutics, and vaccines. Medicines are very expensive, and we have seen now with the financial constraints we are having in the continent, I think we have to come with the innovative measures. And one of them, apart from increasing our domestic financing, how about pooling our resources, including the small islands which we've just discussed, and do this bulk procurement? We can have a better negotiation of prices, whether with Gavi or Global Fund, when we work, because all we need here is to work together. 2, pandemic accord, which you are going to adopt tomorrow, gives us another chance of Africa. Time has come to have our local manufacturing capacity. Now, while we are trying to do that, why don't we start by 2 things? We have regulatory things which have to be looked after, and we have good examples. We look on Ghana, we look on Tanzania, we look on Egypt. I know it's not in our region. At the same time, we have to build on the workforce. Who is going to work in this? Because, okay, the pandemic accord is going to be agreed tomorrow. So I think it's very important, all these things to go in parallel. Build our workforce, the financing, which we have just discussed a little bit, pool procurement. I think we can, I'm very optimistic that it will reduce the prices, we can get the generics, the patents can be discussed, but we have to start now. And the regulatory, if you see all these countries, they've got level 3, Tanzania now is going to level 4 of regulatory, so we can learn from each other. But the ones which we have now, why we have a ground where to start. I think it's just a matter of decisions. And I think this decision was supposed to be made yesterday. Thank you, Honorable Minister.
We now have Central African Republic.
Merci.
Thank you, Madam Chair. Honorable candidate, Professor, you have stressed support to countries and direct work with the countries. Could you describe to me in concrete terms how you are going to manage this in order for the WHO at the country level to change its way of working in order to have a greater impact?
Madam Chair, kindly, I missed the question. The device was not working. I just said how I had the last bit.
Can you kindly repeat Central African Republic?
We have translation is not good. I see that the question that were asked by my Cameroon was not well translated, and mine was very clear. Now I'm going to speak in English.
Please ask your question.
Yeah, but this need to be taken into account, Chair. Yeah, the candidate stress the need to make WHO work better and in an impactful manner at country level. He would work closely with countries. I would like him to describe how this transformation will happen at country level in a way that he is projecting.
Thank you, Honorable Minister from Central Africa, for a very important question. I think I touched on it, but let me say it again. We have 47 member states with different level of development, different level of economy, different level of challenges. I think among the first things which I'm going to do is to speak with member states. And as I said, our challenges in Africa is not a one-size-fits-all. There are those who they are a little bit farther than the others. So among the things which I'm going to give priority is to try to understand, do a DNA, who has what. I'll give you a very simple example, Honorable Minister. How many member states know that Tanzania does major heart surgeries? How many people know Kenya does kidney transplant? So I think we need to map. We might be having, which I believe we do, a lot of resources among ourselves, and there's no better time for solidarity and working together, not in silos like now. So where I'm going to find deficiencies in Central Africa, maybe in South Africa I can get the expertise. So that exchange of expertise and collaboration, Honorable Minister, will be very important to me. And I think this is how I'm going, because how I'm going to solve or discuss solving with you the problem of Central Africa might be very different from the ones in Burundi. So we'll work together and forge our way forward. Thank you, Honorable Minister, and thank you, Madam Chair.
Thank you, Professor. The time allocated for the interview is now exhausted. I wish to thank Professor Yakub for being with us today. Now, I'd like to ask the Secretariat to accompany you out of the room. While the Secretariat... While the Secretariat is accompanying the candidate out of the room, the next candidate, Professor Mustafa Majayapwaya, proposed by Togo, is to be brought in. I will ask the delegations to remain in your seats so that we may commence immediately the next interview, as soon as the next candidate is here.
Mkuu wa chuo cha Kilimanjaro Institute of Technology and Management kilichopo Mwenge, Dar es Salaam na chenye ithibati na usajili wa NACTIVATE anapenda kuwatangazia ofa maalum wa wahitimu wote wa kidato cha 4 kozi mbalimbali za kompyuta zikiwemo Computer Application, ICT for Beginners, PC Maintenance, Video Production, Graphics Design pamoja na CCTV Camera. Pia mula mpya wa somo kwa kozi za IT, Business, Hotel Management na Front Office. Kumbuka, sifa yetu kubwa ni ufundishaji kwa njia ya vitendo. Kwa maelezo zaidi, piga 0754464361 au 0766348652. KITM, elimu na ujuzi ni msingi imara.